Welcome everyone who's joining live. So nice to see everybody here. Appreciate anybody who ever registers for these things. I'm always so excited to have you join us. And I'm going to get started because there's a lot to cover. And I want to also be cognizant of our time together. So thanks for those of you who registered and are attending live. Obviously, if you are not able to attend live, that's okay, because as you can hear as you're coming in, we are recording this session, or if you have to bounce and leave a little bit earlier, you're going to get a recording link of this anyway after the event. And I'll talk a little bit more about that shortly. So this is National Nutrition Month, a dietitian's favorite time of year. This is March, and I want to, if you've never heard of this before, or just to introduce you to what is going on, then I'll explain a little bit about who I am as well. This is the Academy of Nutrition and Dietetics. They are an overarching membership organization that oversees our profession, and every year they put together this National Nutrition Month, and the theme for this year is Food Connects Us. So I wanted to focus on quite a few things around that in the slides coming soon. But first, what I'm hoping that you'll take away from this is a little bit of a deeper understanding of things like where your food comes from, some community resources, and some things that actually help us connect to our food. Some housekeeping things. As always, you heard when you just logged in that this session is being recorded. So as I mentioned before, when we are done and we wrap up, and as soon as I get my act together in a handful of days, I will send out to the currently registered participants of this event. You'll get a link to the recording. So if you are not able to attend live, you'll be able to watch this on your own time in the near future. And in about a couple of months or so, this information, this webinar is also uploaded to the DishWithDina TV YouTube channel. So I say that just in case you want to open up your camera or unmute yourself, that obviously it is being recorded, but I've pinned myself so that I'm the only one that's available on site right now. So it's not like we can see your names or anything like that, in case that's something you want to keep in mind. I am flying solo today. I don't have somebody who's helping me moderate the chat. So I'm going to check the chat box as the webinar progresses. If you at any time want to chime in, or I might ask you to chime in and comment on some things, you can always use the chat box. But we do have a formal Q&A carved out at the end of our webinar. These usually go about 40-ish minutes or so, so just keep that in mind if there's anything that you need to hop on or hop off at any time. I always say that I am a dietitian. I'm not your dietitian, so anything that I'm sharing with you is not to be taken as medical advice. Please make sure that you are meeting with your own personal, individual healthcare professionals before you start or engage in any kind of new or changed revisions of your medical and health regimens. And when you register for this, obviously you're submitting your name and your email address, so you are part of our email list going forward. And so you'll get the follow-up email with the link to this recording and a link to the survey, so you can give us some feedback to help us improve upon or work on new topics going forward. But we also send out a monthly newsletter too, which obviously you can always unsubscribe at any time if you want to. If you've never met me before, hello, my name is Dina D'Alessandro. I am a registered dietitian nutritionist. I do a bunch of other things that you can see here on this slide, but I'm going to not dive in too deep on this because in addition to March being National Nutrition Month, at the time of this recording, at the time of this live event, we also celebrated on the second Wednesday of every March, we celebrate Registered Dietitian Day. So we just celebrated that. So I wanted to kind of fold this into today's conversation just to give everybody some insight into exactly what a dietitian is and what we do. So as you can see here on screen, we do consider ourselves to be nutrition experts, and I'll talk to you a little bit more in depth about that shortly. We provide services that are known as medical nutrition therapy. So we work with people who are either preventing or managing or trying to slow the progression of a particular diagnosis or disease state. And we coordinate both education and counseling into our sessions with our patients, where we help them modify food and nutrition or understand how food and nutrition plays a role in supporting their overall health. Obviously, we can also work with people who just want some general habits and helpful information as they make choices in the supermarket, but really our role is to be integrated into a more clinical setting, whether that's inpatient or outpatient, and I'll talk a little bit more about that as well. We do strive to meet evidence-based practices. So we keep up with a lot of the current research and we weigh the kind of the weight of the research that is available to us in making our recommendations going forward. A lot of the nutrition guidelines that are presented as kind of like an overarching guidance are also based on the evidence that is out there. I'll talk a little bit more about highly trained professionals. And yeah, we really want to create a patient-centered care approach where we are working in a mutually beneficial relationship with our patients. Everybody who is dealing with an experience can take ownership of that. So I, as a dietitian, am here to guide and support and help remove obstacles, but we want to make sure that our patients get a say in what their health outcomes are as well. Okay, so the what of all of this, what distinguishes registered dietitians outside of other wellness providers, whether we're talking about life coaches or registered nurses or wellness educators or anything that is either in the more specific field of health and wellness, or I should say the general field of health and wellness, or a specific field like cardiology, we have to complete a master's degree. We also have to attend a dietetic internship, which is year long, and we do have to pay for that out of pocket. So there's a lot of blood, sweat, tears, time, energy, and money that goes towards having us get credentialed as registered dietitians. We have to also take and pass a nationally recognized, or I guess you could call it a board examination. We have to also meet the requirements of maintaining continuing education or specialty practices as well. We can get specialized in things that are specific to either patient life cycle, populations, or disease states. And then we also have to maintain state licensure, and I'll talk a little bit about that in a second too. Not every dietitian works in a private practice or a clinical setting, but when we do, we're making sure that we are establishing ethical billing practices. So if we are working with your insurance companies or we are charging you out of pocket, we're making sure that we're doing the proper billing and coding to make sure that we're covering what is available to you with your diagnoses and anything else that may or may not be covered through your health insurance. So where can you find a dietitian? Everywhere, every place. There are, I think at the time right now, I think there's about 112,000 of us, just to give you an idea of what that means in relationship to other healthcare providers. There's about 1 million medical doctors in the generalist field, and then there's about 2 million registered nurses. So 112,000 registered dietitians sounds like a lot, but obviously we would love for there to be more so that we can really provide that kind of like one to many, but not too many approach in our relationships and supporting the other healthcare providers that need us. What you see on screen here, this is color coordinated to indicate the kind of like the strictness of certain laws state by state. So registered dietitian is a nationally recognized credential, a title. Excuse me. And then each state that you see there has either very strict or very lax laws and policies. So for instance, I'm registered dietitian, my national title. I'm certified or licensed in the state of New York, but I could also work with people in Texas and I can also work with people in Oregon, depending on some of the disease states that I'm working with. I cannot work with people in Florida because they have much stricter licensure laws, so I would need to also be licensed down there. And I share this with everyone too, just because this is known as title protection or practice exclusivity. And some of those more stricter licensure states, you can't just be like a personal trainer and talk to people about food, or a health coach and give people meal plans. Like, you have to really be careful with what you're doing to make sure that you're not getting fined or, unfortunately sent to jail or getting penalized in some way. So it's always good to know what the background is and what the qualifications and the credentials are with any healthcare practitioner that you're working with. This is probably just a small example of all the practice areas that you might find dietitians in. So if you go back to that introductory slide that I shared with you earlier, I do business and communication, I do coaching, I do community and public health. I've had experience in culinary. I'm already in entrepreneurial and private practice. I've had experience in food service systems. Let's see, management and leadership. I've done that too. Wellness management as well. On the right-hand side, let me move these little boxes out of my way here. I've done research. I'm doing telehealth now as part of my private practice as well. I don't do school nutrition, like I'm not in charge of creating meals and menus for a school, but I am the on-campus dietitian over at Lehman College in the Bronx, part of our city university school system here. So I do that too. And I'm also the adjunct lecturer as well. My joke is always, am I an entrepreneur or am I just working 7 part-time jobs? cobbled together quite a lot. But you can see there's quite a variety of things. And that's kind of cool because I think sometimes when people hear registered dietitian, they think, okay, you're just going to tell me to like eat a salad. But we really have such a diverse amount of experiences and practice areas that we can get involved in. When do you need to see a dietitian? Whenever the heck you want to. Come hang out with us. I always feel like it's a very beneficial thing to consult with a dietitian at any stage of life or anytime you feel concerned or curious about your food choices and your health habits. But really, we're trained in a variety of different chronic disease states, high blood pressure, heart disease, food allergies, cancer prevention and cancer treatment, support in long-term care, acute care, life cycle nutrition, pediatrics, pregnancy stages, and helping people if they are in the athletic field or the sports as a section as well. So quite a wide variety again here of things that we can help you with. So I share some of this here on screen, some a little like behind the scenes snapshot of things that I am doing and have been doing in the past because whenever I do these wellness webinars, I don't think people really get an insight into what I do. So the left-hand side is just a quick snapshot of me in school, in my classroom. The middle, I used to be really heavily involved in a lot of social media stuff, and I would do these like pop quizzes every week to engage the audience of, different topics of the week. And on the right-hand side is an example of a flyer that my school provides the campus because I am the on-campus dietitian. So even though that's an old flyer, I'm still working there. I think I'm coming up on 6 years now, if I'm not mistaken. I also want to take a moment just to recognize some of the underrepresented groups and specialty practices because, again, dietetics is a lot going on and there's a lot of barriers of going through the whole process of being them. So I took some snapshots of people that I know somewhat online and sometimes personally. This is Jessie Wang. She represents the Chinese population. She lives in California and her specialty practice is around gut health, specifically irritable bowel syndrome. This is Kim Rose. She focuses solely on type 2 diabetes and pre-diabetes nutrition. She's got a great YouTube channel. She does a lot of little quick insights and provides a lot of free resources for anybody who's interested in learning more about her. This is Kristen, who focuses on the older population and caregivers. Again, sometimes, we recognize certain life cycles need a little bit more support than others. This is a former intern of mine. That's Zoe. She is a registered dietitian, but she focuses in traditional Chinese medicine. She hails from Shanghai, and she is a world traveler. So she does a lot of cool things when she's traveling the globe and shares a lot of her experiences with everybody online as well. And then last but not least, we have Kimmy Singh, who is a dietitian in a larger body, and she really supports and tries to reduce the stigma around weight and fat discrimination. She's been an integral part of a lot of laws and policies here in New York City recently, so I'm very proud of her, and I've met her in person too, so that's kind of cool just to share some insight with you. So thanks for indulging me as I walk through all the stuff of what it means to be a dietitian. And now we're going to talk about the topic of today. The topic of today is how food connects us. And we're going to start with understanding a little bit about where our food comes from. I just want to start also by disclaiming that based on current state of affairs, because everything is political, I'm not going to be controversial when I say these things, but there have been a lot of changes going on in the current administration. So some of the information I'm sharing with you or some of the programs that I provide as resources here, it's possible that they might be irrelevant in some of the future time to come. So obviously, please make sure that you're engaging in your community, make sure that you're voting and understanding how you can interact with your representatives, and also recognizing the social determinants of health, meaning that not everybody has access to everything equally. So take whatever you can from this conversation, and hopefully some of the resources I provide for you can support you if you need to be. So food just doesn't magically appear on our plates. We want to always recognize that it does have a journey that connects us to things like farmers and food suppliers and even the environment, like picking fruits off of trees and so on. We have a variety of places across the country. Every ingredient I really feel like tells a story. And I think especially in, the current times of immediate gratification, the go, go, go hustle culture, it's hard for us to really slow down and recognize and be respectful and honor where our food comes from. So I'm hoping some of what I'm sharing with you today gives you that connection again. So I think that also helps us with deepening our appreciation for all of the stuff that goes on behind the scenes, the labor, the knowledge, the tradition, everything that is involved in producing our food. Also recognizing global trade, which is connecting us to things that are not available locally. So we have things like bananas from Central America, spices from India, seafood from the Pacific, just to name a few there. And since I'm coming to you from New York City, New York State, I just want to honor and recognize too the nearly 32,000 family farms that produce both locally and across the world. They send out their food and beverages. So this is kind of cool. Like we have a lot of stuff going on in the Northeast that is recognized as production and able to sustain both, like I said, nationally and globally. On a more specific state situation, we have what's known as Grow NYC, which provides us with maps and locations and green markets. So if you feel like entering in the chat, feel free to do so. Have you visited a farmer's market? Do you know if you have a local green market that you can check out? Even if you don't buy anything from there, just like sample some things or walk around and get to learn a little bit more about what products and maybe chat with the farmers that are there as well. Sometimes there are also vendors like, honey vendors or lavender growers, and you really it's such a cool thing, I think, to connect with, especially in the city where it literally is, the concrete jungle, as we say, to be able to see all of this greenery and this food and this produce come through, really helping us connecting with that. So feel free to chime in if you want to. If not, that's okay. And if you're watching the recording of this too, you can always put a little comment in there or send me a note if you feel like it, to let me know how you connect with your locally grown farmers markets and green markets. So I want to also share a little bit about the cultural significance, because we're talking about expressing our cultural identities, regardless of where you hail from, or if you have an immigrant family that has come from other places across the globe. Think of like recipes that you consider, or ways that you have traditional dishes, the way that you celebrate things. Any of these things really allow us to, again, express our cultural identity, preserving the heritage too. Like I remember opening up recipe books that my mom had from my grandmother, and you can see like the handwritten notes on a very greasy piece of paper. And it was so sweet just to be like, she sat there and she wrote that. And that makes me feel very connected to her too. So think about things that make you feel really connected, or things that you are sampling now and learning more about. I am currently signed up for a 6-week culinary nutrition virtual series. So I want to show you a couple of things that I'm learning from that too, because I think this ties in quite nicely with today's topic. We are I forget. We are currently, I think, in the third week this week, or maybe the fourth week this week, and it's 6 weeks total. So we had Venezuela, Hawaii, Germany, and then we're going into Japan, Afghanistan, and India. And so here is a snapshot of one of the presentations that was shared with us when the dietitian from Hawaii was talking about her food ways and her cultural background. And if you remember, or you know what the food pyramid is, this is their representation of it. This is kind of like a very beautifully designed watercolor representation of the food pyramid. So you have to kind of focus in a little bit from top to bottom. You can see the healthy fats and some of the more highly processed foods on the top. And as you go down the slide there, then it has, very vibrant, colored, deeply colored, rich fruits and vegetables and plant-based foods. They even acknowledge some of the equipment that they use to make their traditional dish called poi. If you attended the root vegetables webinar a few months ago, we talked about poi and the root vegetables. You can also see they acknowledge physical activity in the way that is appropriate for their environment. So they have canoeing and surfing and swimming. And then if you look far in the background, up in the mountains, you can also see faces etched into the background, because again, they're acknowledging their ancestors. They're acknowledging the hunters and gatherers of the days of yore and things that bring them together. The rainbow indicates eating a rainbow, which is something that we say a lot in the dietetics world, like making sure you're getting a lot of different vitamins and minerals from a wide variety of food. So I absolutely loved this when I saw it, and it was quite an emotional discussion to hear about the history of Hawaii, and something that I wasn't really familiar with. Then we had another dietitian who hailed from Germany, and again, she shared her traditional foods. And I think this is something too that, if you look at all of the pictures here, you can maybe see things that are recognizable to you. So maybe you don't call it muesli, maybe you eat granola or oatmeal. Grain-based foods are a big staple in quite a lot of cultures and just everyday meals in America as well. If they have sauerkraut and sauerbraten, they have those fermented types of foods. So maybe you've eaten kimchi, or maybe you eat coleslaw, or maybe you eat cabbage in some way. Then they have an egg noodle dish called spätzle. So that is also something that to me looks very recognizable. In the Italian tradition, we have small pasta dishes like orzo. So a lot of these things are very comparable to the things that I think I'm already familiar with, and maybe you feel the same way too. And then last but not least here, I wanted to at least recognize sometimes the vilification of the non-traditional or non-American foods. As you can see on the left-hand side, this is just a snapshot of Dr. Kambra, who is a dietitian, and she speaks a lot on behalf of the Black and Brown communities, where, you'll hear things like soul food or Southern cooking is going to give you a heart attack, and switch over to the Mediterranean diet. And that really doesn't do justice to the Black and Brown communities because they're not part of the Mediterranean area. And if you look at the right-hand side here, where you can see the African Heritage Diet Pyramid, it looks very much like the Hawaiian one that we just saw, and also the food pyramids that we've seen before too. The hierarchy of the more healthier foods, the more indulgent foods, and even recognizing there on the bottom, the social engagement, social interaction, and physical activity. So again, making sure that we're not coming in too hot with some of our biases about different kinds of cultures and different kinds of food ways, and recognizing that we all have the ability to eat healthy in our own way, shape, or form. Next up, just to share with you a little bit about how food plays a role, as I'm sure you know, in social interactions and celebrations. Meals really serve a purpose in cultural touchstones and allowing traditional, or I should say, allowing different communities to celebrate their traditions, whether it is in a more intimate setting or it is at a larger gathering of some kind. I think that interaction really helps with building and bridging those stronger community ties and connections. Things like communal meals. I know in New York City we have like beer gardens and communal tables at a lot of places, these restaurants that actually sit you down in kind of like a forced community gathering. But I think that's kind of cool. If you're introverted, I can see where that might make you a little uncomfortable. But if you're looking to experience something and chat with your neighbor who you've never talked to before, it really helps with engaging that. And there's definitely some psychological benefit about sharing meals with each other, right? Breaking bread and having those conversations that help us dive a little bit deeper in recognizing each other's similarities and differences, and helping also reduce some of that isolation that comes about too. So maybe this is a community kitchen or a soup kitchen or a food pantry that has an extended area where people can sit down, eat, engage in discussion, and share stories with each other. We are currently in Ramadan, so I just wanted to recognize that as well, that obviously, celebrating your cultural and your religious ceremonies, whether, again, it's the communion, rite of passage, fostering that sense of belonging and the continuation of that storytelling. This also helps with promoting understanding and empathy. It helps us think outside the box a little bit and recognizing that, again, maybe we can find we have a lot more in common with each other than different. And in the stage that we are right now with technology and capturing everything on our phones, we can create great memories and be able to look back on things. And, I think even sometimes not just looking at something, but like it brings back smells and the memory of the conversations that I had. And oh my gosh, I loved that dish and I can't wait to eat something like that again. And also providing emotional support too. So, for people, again, if they're isolated, feeling a little bit lonely, literally inviting somebody to the table to have a seat at the table can help with combating loneliness and offering compassion in that way. Next up, I want to share community building through food initiatives. So the impact that things like your community gardens, your farmers markets, your food co-ops in spaces that are urban and rural, some of the successful community food programs that have fostered some social cohesion. So let me stop on this slide just to kind of give you an overview. Or I should say, an example of some of the things where food initiatives play a role there in disease prevention and treatment, health equity, life cycle nutrition, etc. Some examples that I have written down here in front of me are things like breastfeeding in the workplace. That was technically related to a food initiative. Child nutrition reauthorization in the WIC programs as well. That's women, infants, and children that help provide supplemental food, nutrition, and support to children ages 0 to 5. We also have things like access to diabetes self-management training. So that's something that is related to a food initiative and helping people understand how to manage their diabetes, both in self-monitoring, finger stick, and food modifications. We have something, I think this is still going on, the Farm Bill, which is not only about what the farmers grow, but what is available for access in the United States food supply and providing subsidies to farmers because it takes a lot of effort, energy, and often a lot of money to manage that equipment and to make sure that those policies and those standards are met to support the farmers and the farm workers as well. Licensure and professional regulation comes into this as well because it ties into the food and nutrition stuff, specifically with dietitians, where just like I showed you before with that United States view of making sure that we are the people that are able to be recognized as the experts. We are able to provide services that can get reimbursed through health insurance to take away some of that maybe financial hardship. So that is also included in some food initiatives as well. And then the last thing I have on here too is things like Medicare coverage for those medical nutrition therapy services. Again, specifically talking about registered dietitians. On this next slide here, you may or may not recognize some of these programs that are related to food initiatives. Some of these are local, like Hunter College is a New York City school. They have a whole food policy center. They have a newsletter that you can subscribe to. Sometimes they hold virtual or in-person conferences, depending on where you live. That might be something of interest to you to sign up and get some information or get on their newsletter and see, again, like keep up with some of the research and the things that are going on in the local world, local section. Just Food. City Harvest, Meals on Wheels. Again, they do food conferences. They really try to make sure they're focusing on sustainable practices and providing access to food to people who might not be able to have access to that. Same thing with SNAP benefits as well, the supplemental nutrition program that used to be known as food stamps. Just Say Yes. I think that's a New York City specific thing, but I'm sure nationally speaking, there's something similar to that. We have the farmers markets. We also have something called Stellar Farm or Stellar Market, where they provide opportunities to students and interns to work there. They do seasonal work and they're doing community education. They do hands-on training with, how to slice and dice food and creating recipes. And then that middle bottom one, which is the World Central Kitchen, that's Jose Andres, a very well-known chef. He has, if you're in New York City, he has the Bazaar on West 28th Street, and he has Mercado Little Spain, which is a Spanish food market in the Hudson Yards section, kind of like upper Midtown area, or I should say middle Midtown area. But Jose Andres has been like single-handedly saving the world right now, where he gets all of his workers and they provide food aid to places of devastation that are unable to access food. So I share these things with you if you're on the receiving end of things, but if, because I know a lot of students, interns, newly registered dietitians, general population who likes to get involved in volunteering, reach out, see if you might be interested in attending. Sometimes they have free conferences, or like I said, there's newsletters. You can also check them out on social media, or you could donate to them, whether it's time, energy, or money. So I hope that gives you some understanding of things that might be available to you if that's interesting for you. Next up, we have the role of food in social movements, of how food has been used to kind of bring attention to social issues and mobilize the communities as well. I have here the sustainable and ethical food sourcing. So last year, National Nutrition Month's theme was Beyond the Table. So if you go back, and you can actually see this on the YouTube channel too, last year's webinar talked more about sustainable practices and ethical food sourcing and protecting the planet. So if you want to learn a little bit more about that, you can go back and check out last year's webinar. But I focus here on Slow Food. So Slow Food is an organization, a global movement for individuals, producers, growers, farmers, chefs, organizations, to help support and protect the planet. And also they create an observation and support of what is known as food biodiversity. So if you've never heard that before, what we're talking about right now, wheat, rice, and corn, those crops, those make up about 60% of our food production. But we used to have a lot more than that. About 75% of edible plant species have now become extinct because people are not able to turn over things, or they're not able to support that, or it's not, sustainable in the financial practice. And so our future really does depend on having that biodiversity, much like our gut needs diverse food. We want to make sure we're not just eating the same things over and over again. So slow food is out there helping with defending the diversity of plants and also animals too, where they are learning lessons about things and crops and anything that has been lost to focus on so that we can save some stuff and move forward for a more sustainable planet. The other organization I absolutely love, I've attended some of their conferences too, is Food Tank. Danielle Nierenberg, I think is her name, who runs this. It's an organization, global nonprofit community that works towards a positive transformation in how we both produce and also consume food. So again, they work with farmers, they work with producers, they work with policymakers, government leaders, everybody you can think of, researchers, scientists, they academics, journalists, etc. They're really trying to get the word out. I think they also have the YouTube channel too, where they record their conferences. So if anybody's interested in checking that out or signing up for Danielle's newsletter, if you're interested in learning more about that as well, that could be a wonderful resource for you too. So they work with collaborating on providing sustainable solutions for pressing environmental and social problems. So again, in the chat, if you feel like chiming in, if you've heard of slow food, if you've gone to green markets, if you've heard of Food Tank, if you've heard of World Central Kitchen, feel free to chime in and engage in what I'm sharing with you. No pressure. If you'd rather not interact, that's totally fine. I just want to make sure that you know I am watching the chat because I said before I was kind of flying solo here. Next up, practical ways. How can we engage with food sources and practical ways for us to connect? I mean, where your food comes from, I think, is a kind of a cool thing to learn. I'm hoping I'm sharing a little bit of that with you today and you're taking away what you can with it, but how you move from this point forward with engaging with local food sources directly. So I'm sharing on here in the next slide some of my recommendations of what to do and go. Visiting a farmer's market, like I said before, you can meet with the growers, you can ask how they are doing their practices, what it means to gain insight into those seasonal foods or those locally grown foods. Community gardens, oh gosh, even though New York City is the concrete jungle, I think we have I can't, it's got to be hundreds of community gardens. There's at least a dozen within a X block radius from where I am in the East Village in Lower Manhattan. So some of those are plants, like non-edible things that people grow, is just, plant stuff. And other people are growing food or herbs and things that they're going to cultivate and then bring back home to, be in charge and be in control of some of their food consumption. Even something as simple as reading a food label, or I was looking at a couple of apps recently too. I should have put this in as a resource. I can't remember the names of them. But there are some apps that allow you to scan a barcode on a food item and it'll give you the background of that food manufacturer to then determine if you want to support or not support that particular brand. So researching the brand, learning about their practices. Some of them give money back to things. Some of them will start up food initiatives in other parts of the world, or they'll help with doing education. So I really, as best as I can, I really try to focus in on a few brands that I'm very passionate about. And also this has not just with food, like, makeup brands and household items as well, to make sure that I'm reducing whatever impact on damaging the planet as I possibly can. But I think this also ties into that discussion around traditional food practices and having that level of awareness of, maybe it's like a family brand that has been passed along generations. It's just kind of cool versus the larger conglomerates that kind of take over everything. I think also understanding where our food comes from, as I mentioned previously, with strengthening our relationship to that. So, some people will sit down and say grace when they eat and give gratitude or give thanks to the food that they're eating. Other people will grab and go and eat while they're in the car or at their desk when they're working. So if anything, I'm hoping that this does help you slow down a little bit to recognize honoring and respecting and recognizing the cultures that influence our food and maybe making some more mindful decisions, not only nourishing ourselves as best as we can, if you have the access to do that, but also contributing to a more connected and sustainable world. One of the other things I wrote down here, so again, if you're not from New York City, I'm sorry that I'm focusing just on the examples of NYC, but obviously you can always do a Google Map search. We have a ton of local neighborhoods and communities. Back when I was teaching Food Society and Health, it's 200 level undergraduate class. One of our projects was to send the students out and to do their own field trips of a culture that was not familiar to them. So we have a very diverse population, as you can imagine, in New York City and up in the Bronx even more so. And so they had to go out and check out other neighborhoods or communities that they could report back on. So they would go around and check out the supermarkets and what kind of foods that they were unfamiliar with, or again, pairing up and seeing like maybe that is something similar that I'm used to seeing in my own culture. So in both the Bronx and in the borough of Manhattan, we have Little Italy. We also in Manhattan have Chinatown, we have Koreatown, we have Spanish Harlem up on the east side between, what is that, 96th Street to 142nd Street, spans quite a lot. We also in Brooklyn, we have down in Brighton Beach, we have Little Odessa. So that is a Russian population. So if you've never eaten Russian food, that's a great place. I mean, literally you walk the streets and all you hear is people speaking Russian. So all of the community is set up to support that. Just a quick side note about that. If you've ever heard of the term melting pot, and this was, I think this was a couple of years ago, we did a webinar for National Nutrition Month as well about cultural traditional foodways, where a melting pot kind of like makes everybody, forces everybody to assimilate to a common culture or way, whereas a quote unquote salad bowl recognizes that people are very individual. And I think that's what's cool about a city that is as diverse as New York, that you get a whole little area in Brighton Beach that caters to people who have a Russian background. We also have something like Little Poland in Greenpoint, Brooklyn. Again, people who have immigrated or have grown up with Polish traditional foodways and celebrations that honor their tradition, then they can find things that are very similar. They can look for ingredients, or they can, engage in community organizations or socializing with people that they feel make them harken back and honoring their heritage. Lastly, sorry, Staten Island, I never remember to include Staten Island in the boroughs, but Queens I wanted to share. So they have Little Guyana. If you're familiar with Queens, if you're in New York City, that's around the Liberty Avenue in Richmond Hill. They also have a Koreatown in the Murray Hill or Flushing section of Queens. And then they also have Little India in Jackson Heights. When I was a student at Lehman College, where I'm teaching now, that's where I did my market tour project. So I actually have a friend who is from India, and she took me with her shopping for her stuff. Like she literally came from Manhattan and went all the way to Jackson Heights and brought home, like a 10-pound bag of rice and all of these specialty spices. And I just absolutely, absolutely loved going and hanging out with her. We went to a couple of bakeries and we went to a restaurant. And we sat down and, yes, I'm familiar with Indian food, but not from her perspective. So again, it really helped me gain an insight into something that was not very familiar with me. All right, listen, bonus points right now. If you were watching this, can you name what is on screen? What is that item that is on screen? Because another thing I'm going to encourage you to do is try new ingredients. Try something food-wise that you've never had before that might be of interest to you. So if you don't know what that bumpy product is, they're quite large, by the way. That's quite large. I don't know if this picture is doing it justice, but that is known as a jackfruit. Jackfruit is a species of tree in the fig/mulberry family. It is composed of, so if you crack this open, there's like hundreds or thousands of these little petals that kind of pop out, and they're quite substantial. So these are mostly found in tropical lowlands in areas of India, Bangladesh, rainforests, Philippines, Malaysia, Australia. This is also commonly used in South and Southeast Asian cuisines. When the fruit is ripe, or you could freeze it and you could do other things with it, canned, etc. It's both used in desserts and it's also used in savory meals. This is actually quite a hearty, meaty type of substance. So I can't remember how long ago it was, but I had like a jackfruit taco instead of what would be like a meat substance, they use jackfruit in there. And it's also similar in not texture, but similar in absorbability to like tofu, where you can add spices and flavors to it that it soaks up and it enhances it. So it was like it almost honestly, it felt like a pulled pork, barbecue pulled pork type of substance, because that's what it looked like a shredded jackfruit. So if you've never tried something like that before, I encourage you, check out new recipes. I mean, hello, we're from the future. You can Google things if you want to. You can look up YouTube channels. You can check out, like I said before, some of your neighboring communities that might be focused on a particular culture and see what they sell. See what they sell. See if you can sample something. See if you want to take it home and learn a little bit more about how to integrate that into your meals, your cuisines, and maybe invite people over to test it out with you too. So, my friends, at the end of every webinar, I always ask you, what are some of the takeaways? What are some things that you have heard about? And I know, obviously I could dive in so much deeper and make every single thing I talked about 1 hour long, but what are some things that you might consider? Is there anything you want to start doing? Like maybe going and checking out a new local community or starting a community garden? Is there anything that you want to keep doing? So maybe you're like, I'm already doing all this stuff. I check all the boxes and I enjoy doing it. Continue doing that. This is validation that you're doing the right thing to connect yourself through food. Is there anything you want to stop doing? Like maybe making mindful food purchases if you're not entirely sure of the way that the food manufacturer or the brand is affecting the planet or affecting the environment. So if you want to chime in the chat of anything that you feel like making a goal for yourself, we can all hold you accountable to it right now. If not, just something to consider in the future of how you think you might want to integrate this, and recognizing that, food really does play such a role in so many different things. And I think, like I said before, we rush through so much stuff in our lives that sometimes we don't just sit down and really recognize, wow, that went through quite the cycle to get here. And I'm very thankful for it. I'm also very thankful for you. So once again, for those of you who registered and joined live, thanks so much for being here with me. If you were not able to join live, you'll get a recording. Well, everybody's going to get a recording link of this anyway. And then, like I said, in a couple of months, I always post these recordings to the Dish with Dina YouTube channel. You can open up the chat right now for Q&A, or if anybody wants to raise their hand or chime in and share anything that has come to mind or anything else you want to share. It doesn't have to be related to the webinar, by the way. People sometimes ask me some random food, nutrition related things that don't have anything to do with the topic, and that's totally fine. I do these things for free. I also do these things sometimes by myself. I have some students and interns that sometimes will help me with doing outlines and some of the research. So I want to honor and I'm very grateful for them too. And I also want to ask you for your support. So I'm not charging you anything for this, but feel free to find and connect with me online. Like I said, if you've registered for this webinar, you're already in the newsletter loop of the email distribution. So when you see things come across your way, if they don't necessarily resonate with you, maybe forward things along to somebody that you think might be interested in that. Any other feedback that you have for me, I'm always happy to take in and do whatever I can to make sure I'm providing as much information as possible to make you feel better connected with food, have a better relationship with food. If you want to work with me as a dietitian, so as I was saying before, depending on where you're watching this from, I can work with a variety of people from a variety of states. I do take also a variety of different pretty well-known private insurances as well. I'm always happy to at least field a question if there's anything that comes around that you're not entirely sure of where to go to. And if I can't work with you personally, I can help you. Maybe I can, refer you to somebody that is better set up to be able to support you in whatever your health and wellness needs are. Our next webinar is going to take place on Thursday, April 10th. They're usually on a Thursday because that's just how my schedule is working right now between school and private practice. So Thursday, April 10th from 12 to 1 p.m. Eastern time, we're going to talk about kidney health. Very important conversation to have. I always tell people that I have a deep connection with kidney health. My mom is diagnosed with chronic kidney disease, and I'll talk a little bit about her journey and how to help support your kidney health, and also how to manage or talk to your healthcare providers about your kidneys if that is something that you are at risk for or are currently diagnosed with. So thanks everybody for being here. I hope that you enjoyed our conversation today, this webinar, and I hope to see you again soon.